I'm Jerry Hesch from the Hesch Institute in Aurora, Colorado. I'm a physical therapist, and website is heschinstitute.com, www.he, S like Sam, CH, institute.com. And today we're talking about simple treatment for a side bent coccyx. Now I have other videos that describe a pattern of the lower pelvis called lower windswept pelvis, and you can find those on YouTube, and those explain the evaluation and treatment of the pelvis, and these ligaments can pull on the coccyx, and it's not uncommon to find a side bent coccyx with a lower windswept pelvis, and so treating the whole system makes a lot of sense. But today I'm speaking of only the side bent coccyx presenting by itself, and if I've ever seen a left side bent coccyx, I don't even remember it. Just encounter it to the left. And so the technique that I use, the goal, if the coccyx is side bent left, you're going to have a deeper sulcus because of the transverse process here. When you come off the midline and you palpate up here and you compare side to side, then you'll find that this left side is deeper, and that indicates a left side bent coccyx. And so the technique is to push against the soft tissue. I use the heel of my hand and capture as much soft tissue as I can, which would include partially include the sacrotuberous ligament, and partially include the sacrospinous ligament, and certainly other soft tissues, other muscle in the region. And then after doing that for 5 minutes, I come over on this side, and I actually use a heel to capture the left side of the coccyx. So I come in like this and directly push on the coccyx for 5 minutes. So here's a ligamented pelvic model, and you can see the tremendous complexity of the ligamentous structures, and sacrospinous is underneath here, and then this goes from sacrum and partially coccyx to the tuberosity, ischial tuberosity, so that's called sacrotuberous ligament. And of course you're affecting the sacrococcygeal ligaments as well, the anterior and the posterior ligaments. So for a side bent left coccyx, I first capture the soft tissue with the heel of my hand and push that to the right very gently. I just take up the tension in that system. I'm not aggressive. It's a very gentle force, and that's done for 5 minutes. And then after that, I come over onto the left side of the coccyx, and I repeat the same thing. And this video is for clinicians, and patients can share this video with their clinicians. And as an alternative, you can come to Denver, Colorado. I practice in Aurora, Colorado, just 20 minutes from the airport. And I work very hard to treat the entire pelvis, to balance all passive forces throughout the pelvis, balance normal tone in the sacrotuberous, sacrospinous ligaments, sacroiliac ligaments, etc. Because it is a whole system, and it also takes consideration of the hip joints as well. And I actually treat within a whole body framework. I screen the body from toes to nose, and treat any restrictions there. And in the case of some hypermobilities, sometimes the opposite direction has reduced mobility, and so restoring mobility in one direction can reduce hypermobility in the opposite direction. And again, our website is www.heschinstitute.com. Thank you.